I'm going to be talking about several projects that I've done where we've explored the role of images and image-making processes in expanding the dialogue that can happen around pain. I think very often the patient and healthcare professionals come to the encounter with very different agendas. And what in both the projects we're talking about we're trying to do is see, could having an image between patient and healthcare professional, could that act as a reference point? Could it change the dialogue? Could it actually regenerate the language that happens around it? Because pain is invisible, it's really subjective. And sort of rate your pain on a scale of 1 to 10 may work in an acute setting, but it's really challenging for that to work in a chronic setting where chronic pain is multifactorial, it's multi-layered, it happens over time. So I think a number from 1 to 10 is not going to effectively say anything useful about that person's experience of pain or the impact it has on their life, and then not necessarily help facilitate a smooth sort of encounter between patient and clinician. All the photographs were co-created with patients so that their experience are within all of the images. And then what we did is from a selection of the images made at St Thomas's and at UCLH, we integrated those to become one pack of sort of large playing cards, like sort of visual images, rather like this. And the idea was that we wanted to see if some of these images might actually be useful to other patients in other consultations. So 10 clinicians at UCLH really kindly offered to experiment with these in their consultations. So for 10 of them, they had 4 consultations, 2 using the images and 2 where patients weren't offered the images. And the primary goal of both of that lot was to assess pain. And with the ones where patients were offered the images, they were given them about 20 minutes before their consultation. They were asked to take them and look through them and see if any resonated for them. And if they did, they were invited to use those within the consultation, and they were given very little direction. But it was really just to see how it affected the encounter, whether it made it easier to speak about things that were difficult, whether it provided some sort of shared reference space. What's been exciting is that there's been a wonderful multidisciplinary team who've come together to actually analyse that footage and analyse the results. So when you're looking at the footage, you can see that, for example, when the patients aren't using the images, you've got patient on one side, clinician on the other, and there's a sort of empty dead space in the middle with not much happening. When the cards are here, you can see their limbs sort of going in between that space. It's much more negotiated, and that sense of negotiation seems to continue on for the rest of the consultation. What was exciting is that then the psychologist, Dr. Amanda Williams, who carried out a very statistical and very rigorous non-verbal analysis, was able to prove that actually if you take the non-verbal gestures from the literature, you can evidence that the type of clinician-patient affiliation is improved in the consultation with the cards, and rapport is improved. And some of the clinicians who are working with us, like Professor Joanna Zakrzewska, who I've been collaborating with, has said she's now started becoming very conscious of that space between herself and patient and trying to make it a sort of living space, if you like. The other thing we noticed is that patients' language changes. So instead of using very generic terms, they use very specific terms, very personalised terms. And Professor Elena Semino, who's a linguist working with us, was able to show with a word programme that the number of words that patients use has increased. And it sounds very simple, but normally it's the other way around. And it increased right the way through the consultation, not just when the images are used. And the other thing that's probably the most telling, which all of the team noticed, is that the narratives that seemed to be elicited around the cards were very much sort of the narratives of changes in identity, eliciting discussion of the emotional aspects, either of the pain or the impact of their pain on them. There were more emotional words, there were more metaphoric words, and I think what they seem to act as is a sort of permission giving, because people know that these cards have been co-created with other patients. So if one patient thinks that it feels like having a peg on your lip or feels like a crumbling building, it's all right to say that. It's all right if it feels bizarre, that the clinicians are actually going to listen to them. And I think that means that the important things that that person needs to say at that time are given a space in which to be heard, in which to be aired, dissected, and maybe unravelled by both people. And I think that does help people work with their healthcare professionals to try and plan a way forward, to plan the forward management and feel that what's important to them is part of that picture.